Hello again, I'm Luan Montag with the Living Well program. I'd like to speak to you today on accident prevention and especially fall prevention for the elderly in their homes. Fall prevention in the elderly is a very important topic because approximately 1 million people over the age of 65 fall in their homes annually and require emergency room services. I believe this number probably does not reflect falls that occur outside of the home, which is another concern that we have. Unfortunately, most falls occur in the patient's bathroom. If a person does sustain a fracture, it can be life-threatening because many times the fracture will require a surgical intervention and a recuperation period. The fall can also make a toll on the other health conditions that the person has in the healing process. I believe the most important thing that people can do is to remember to stay healthy and strong. It's very important to stay active. Try to keep the weight-bearing exercise going. Try to walk daily. Keep the muscles strong so the muscles can support the joints and help prevent falls. Something else that people can do is to visit their optometrist annually to make sure they have good eyesight and that eyesight doesn't become a concern as far as seeing where you're walking and hazards in the home. Another important issue to consider is the proper taking of the medications. I have found that putting the medications in a pill box and setting up your pills for a daily routine will help overdosing or double dosing on pills, which can cause dizziness or lightheadedness. If you are being treated for osteoporosis or have not been screened for osteoporosis, you need to check with your healthcare provider. Keeping bones strong and following your doctor's recommendations are important to prevent falls and bone weakness. Another important consideration is to remove all those hazards in your home, so hopefully you will not find something to trip over that would cause a fracture. I would say the number one hazard in a home would be rugs, throw rugs. And again, I said in the bathroom is where most falls occur. So we want to make sure that there are handrails accessible near the toilet and also around the bathtub, grab rails to help you get in and out of the tub. Another important consideration would be raising the toilet seat so it's easier to get up and down off of the toilet. I think it's very important that everything you need to carry on your daily activity should be on one floor. If your freezer is in the basement, if the laundry is in the basement, if the shower is in the basement, you need to get those things onto the main floor to avoid the stair climbing. Certainly, climbing stairs with any sort of a parcel or package or clothes basket is going to promote the possibility for a fall. Second of all, if you feel like you're unsteady on your feet, take your doctor's advice if he says you need a cane or a walker. If getting out of a chair is getting more difficult for you, consider purchasing a lift chair to help with that unsteadiness and getting you onto your feet. Remember when I talked to you about falls in the bathroom? Most of those occur at night. So make sure that you have a night light in your bedroom or in the bathroom so again you can see where you're going. We need to remember also that falls can occur outside of the home. You need to check the outside of your home to make sure there's no cracks in your sidewalks or abrupt steps that are hard to be seen. There should also be no clutter in the walking pathway. Flower planters, again, rugs or doormats need to be kept clear of the doorways. We need to make sure that there's adequate lighting when you're getting out of your car and coming into your home at night so that you can see to get into your house. I also advise my patients that wearing proper footwear is very important. High heels and leather sole shoes don't work very well with ice and snow. And speaking of ice and snow, if there's snow and ice on your driveway or sidewalks, it should be cleared. And for heaven's sakes, if it's an ice storm and you feel you need to go to the bank or uptown to the post office, remember, it's not worth it. The mail and the banking will wait until the weather clears. We all know that falls can happen. And certainly if you're living alone in your home, I feel it's important that you would obtain a lifeline. A lifeline is a device that can be worn around the neck or around the wrist. It has a button that is pushed if you should happen to fall and need help, and notification is sent to either a neighbor or a relative to come and check on you in your house. Lifelines can be obtained through the Community Health Department at Palo Alto County Hospital. The cost is minimal, and I very much do feel that in an emergency, it's very good to know that someone can be summoned. There also is a new product out called an auto alert, which you do not even need to push the button. The auto alert senses that the person is fallen or is in trouble, is not responding, and automatically the alert is sent and help is summoned. I hope that some of these tips on fall prevention in the home will be beneficial to you, and hopefully you will live long, healthy, and strong. This is Luan Montag with Living Well. Have a good day.